Hello, lesson 2. Here we go. Cardiac emergencies and giving CPR. If you're watching this, you already learned how to give CPR. But here we go. A little review for you. So we're going to talk about heart attacks first. A heart attack occurs when the blood flow to part of the heart muscle is blocked. For example, causing to die, leading to permanent damage of the heart muscle. Seeking advanced medical care as soon as the signs and symptoms of a heart attack are recognized minimizes the damage to the heart and may save a person's life. Very, very important. Every minute counts in a heart attack. So making sure that you know what to do when this happens is super important. So a little review here. What are the signs and symptoms of a heart attack? There are many, all right? Chest pain, discomfort, pressure, squeezing that lasts longer than 3 to 5 minutes and is not relieved by resting, changing your position, or taking medication. Something that goes away and comes back. Discomfort or pain that spreads to one or both arms, the back, the shoulder, neck, or jaw, and the upper part of the stomach. Dizziness, lightheadedness, trouble breathing, noisy breathing, shortness of breath, breathing that is faster than normal, nausea or vomiting, pale, ashen, gray or blue skin, sweating, a feeling of anxiety or impending doom, extreme fatigue, and unresponsiveness. People may experience the signs and symptoms of a heart attack differently. Not everyone will have every sign or symptom. People who have had a heart attack before may not experience the same signs and symptoms if they have a second heart attack. All right, your first secret word for this lesson is going to be pig. Oink, oink. You're going to use the word pig. All right, here we go. Moving on. Talking about men versus women. So men often have the classic signs and symptoms of a heart attack, such as chest pain and pain that radiates down one arm, while women often experience milder chest pain and more general signs, such as shortness of breath, nausea, vomiting, extreme fatigue, dizziness, or lightheadedness. Because these symptoms are so general and non-specific, women may experience them for hours, days, or even weeks leading up to the heart attack, but dismiss them and say they are nothing out of the ordinary. So signs and symptoms of a heart attack may be more subtle depending on who it is, especially someone with a different medical condition such as diabetes. Many people who are experiencing the signs and symptoms of a heart attack wait too long to get medical care. Some of these reasons they wait is because they are just not knowledgeable about it. So they aren't able to recognize the signs and symptoms of the heart attack. They have denial or fear, potentially just scared about what's going to happen if they are having one. They might feel foolish if they go in thinking they had a heart attack and they didn't, or they just don't have access to certain health care. All right, so if you think someone might be having a heart attack, it's very important you call 911. Be prepared to give CPR and use the AED if they become unresponsive and you're trained to do so. Help the person rest in a comfortable position and make sure you loosen any tightened clothing. If the person takes or if the person might be having a heart attack, offer to get them their prescribed medication if they do take some, and reassure the person and monitor their condition. Let them know EMS is on their way, and they will take over when they get there. All right, so that is heart attack. Moving on to cardiac arrest. Okay, you may have heard both of these terms before, but not quite known the difference. So, cardiac arrest occurs when the heart stops beating or beats too ineffectively to circulate blood to the brain and the other vital organs. Cardiac arrest frequently happens suddenly without any signs or symptoms. So, the difference here is the heart stops beating or beats too ineffectively to circulate blood any longer. Cardiac arrest includes cardiovascular disease, severe trauma, breathing emergencies, electric shock, and drug overdose. In children and infants, the most common cause of cardiac arrest are often breathing emergencies, chest trauma, and congenital heart disease. Although a heart attack can lead to cardiac arrest, the two conditions are very different. In a person in cardiac arrest who is not responsive and not breathing and has no heartbeat. Now we're going to talk about the cardiac chain of survival, why it is important, and what it is. All right, giving CPR, switching over. All right, so hopefully that is a good view of our adult. And here is the infant. So as you guys all know, it's just a little bit different from how you're going to want to use the two fingers. You still want to put the hand over the forehead. And now when you take a breath, you'll put your mouth over their nose and their mouth. All right. So we've already practiced while we watch. We've already done that. So we're just going to move right into if the chest doesn't rise. Okay, so if your first rescue breath does not cause the chest to rise, you're going to want to retilt the head to ensure that the airway is properly open, to ensure that the person's nose and mouth are properly sealed before giving the second rescue breath. If the second rescue breath does not make the chest rise, an object may be blocking the person's airway. If the second breath doesn't go in, immediately start the next set of compressions and never attempt more than 2 rescue breaths between each set of compressions. After the set of compressions and before giving the rescue breaths, open their mouth, look for an object in the mouth, and if you see it, you're going to want to remove it with your finger. So for an adult, you're going to want to do your pointer finger. For an infant, you're going to want to use your pinky. So be sure that you can actually see it inside their mouth before you attempt to remove it so you don't lodge it further into their throat. So after you remove the object, make sure you give 2 rescue breaths as well. All right, so if you're unable or unwilling for any reason to perform full CPR, give continuous compressions at a rate of 100 to 120 beats per minute. Also to the song Staying Alive. Continue giving chest compressions until another trained responder has come on the scene. Just make sure you continue to do those compressions. All right, your last word for this lesson is banana.